My name is Dr. Eliud Owalo. I head Division of Professional Standards and Human Resource for Health at the Ministry of Health, Kenya, the National Health. The most important thing with the medical camp is that it's a very essential place where you gather data that will help inform policy and, of course, surveillance on the prevalent diseases within the community. While we are still ongoing with this process of data collection through this medical camp, we have many people that have been seeing. We have seen a tune of around 5,000 plus people. And with this number, then for each person that we see, we keep the counterfoil of their prescription pad. And we use that we'll sit down to analyze that counterfoil or that counter copy of that prescription pad to see and to come up with a graph of what are the prevalent kind of disease conditions within this region.
So my name is Dr. Onyango Ndonga. I'm the chairman KMPDU Nyanza and also a resident of obstetrics and gynecology at the Moi University and MTRH Hospital. So today we are very pleased to serve the people of Luak in Siaya County. From KMPDU, we want to participate in some of these community activities because it helps us to define the problems of our communities. What we are trying to do in this particular medical camp is to, one, make people know that the healthcare services are available, or rather to improve the health-seeking behaviors of the population. The second thing is we are sort of collecting data. This data is going to help us to agitate more for patients, right? Especially in terms of cover, in terms of facilities and the presence of availability of medications in the facilities. There's something we call the 3 A's of healthcare, where the first A is affordability. Most of the patients we are seeing here are patients who have been seen before in health facilities. In one way or the other, they've not been able to afford medical care. Maybe they are not able to afford the drugs, they're not able to afford the tests that have been requested. Secondly, we are seeing that most patients need a particular service that is not available in this locality. That means they have been referred to far off counties. Some of them don't have transport, so they just suffer silently in their houses. So when we get such kinds of data, we will, we go to all the fora and address our governments and tell them that, look, your people need this particular kind of service that is lacking in your counties, and therefore you may need to address 1 or 2 issues so that we do away with these kinds of problems.
It's been an eye-opener because generally I think the uptake has been good. So far we have done screening for around 60 patients, and generally out of these 60 patients we are doing just the basic screening, which is called VIA, visual inspection under acetic acid. And out of these 60 approximately that we've already screened, we've actually realized around 14 to 15 of them actually have some suspicious lesions. Suspicious lesions means now they need to go for further screening so that now a proper diagnosis can be made. And out of these 14, we have around 4 who actually have what now looks suspicious of generally cancer of the cervix. So that gives you a very grim picture on the burden of cancer in this region and the Republic as a whole. As you all know, cervical cancer is actually the leading cause of mortality in the female reproductive group, and generally it is the second leading cause of mortality nationally in terms of cancers-related deaths. So it's a huge burden, and just from this society alone, if you can see that out of 60 women who have been screened, already 4 we have already picked as having what looks generally like cancer, just awaiting biopsy-proven results. It shows that there is a very huge gap, and I'm really grateful for the foundation for giving this community that opportunity to have this screening done. Hopefully, the few that you have been able to detect are in the early stages and generally can be treated effectively. So it's a huge support to the community, and I'm sure without this medical camp, probably they would have not had the same the early detection that they've had now. Yeah.
Good afternoon. My name is Martin Wamalo. I coordinate wellness at Equity Afya Network. And one of the conversations we champion and enhance is that we engage with the healthy population in an effort to maintain and promote good health. This includes we give empowerment talks in terms of health talks, we do screening, and we do management of the chronic disease so that people can live healthy lives. So it's a noble cause. A conversation with healthy people is quite, impactful, because then when they're well empowered, they can make very well informed decisions. So the initiative is to, engage the community, promote health, and the partners who are sharing that cause with us is the ones now we partner with, and we enhance and champion that particular channel.